Today we are going to talk about case reports. In the epidemiological study, there are two types, descriptive and analytical. In the descriptive, on individual basis, case reports, case series and cross-sectional surveys, and based on the population, there is ecological studies. In analytical studies, there are two types, observational and interventional. Interventional, we call it as a clinical trials. And in case of observational studies, case control and cohort studies. So in today's lecture, we are going to concentrate on the case reports. These case reports will be considered as a individual study, and it is one of the type of descriptive epidemiological study. It is the type of descriptive epidemiological studies. Now, what is mean by case report? Case report is an article. Case report is an article that describes and interprets individual case. You have to concentrate over here that it's an article that describes and interprets an individual case, often written in the form of detailed story. It's a detailed story of the individual case report, not a case series. When more than 10 cases are reported together, we call it as a case series, right? But when individual case is explained and often written in the form of a detailed story, we call it as a case report. Detailed presentation of a single case. Detailed presentation of a single case is called as case report. It will generate hypothesis regarding the pathophysiological mechanism. This is the important advantage. It will generate hypothesis regarding pathophysiological mechanism. What is the etiology? It will explain the etiology regarding the mechanism, why it occurred. Now, case reports often describe unique cases that cannot be explained by known diseases or syndromes. Means whatever is normal is not reported in the case reports. Unique cases, there is something different. Unique cases that cannot be explained by the known diseases. Some clinical features, unknown or extraordinary, or some unique things that you have to explain in the case reports. Case report shows an important variation of a disease or condition. Important variation in the disease or condition. Unexpected event that may yield new or useful information. Unexpected events or unexpected diseases. One patient has two or more unexpected diseases or disorders. All this you can report in case of case reports, but you have to explain an individual case in detail, and that's why we call it as a case report. Now, in level of evidence, it will considered as a lowest level of evidence. Lowest level of evidence in the pyramid. This is the pyramid of level of evidence. So this case report will come at the base level or lowest level, because it explains the things about only single case. It is not valid for the group of population, but it will tell something which is new, which is unique, which is extraordinary. And the important thing, though it is a lowest level of evidence, but it's a first line of evidence that you don't have to forget. It's a first line of evidence, because they are where new issues and ideas will going to emerge, and this is why they will form the base of our pyramid. They form the base of the level of evidence. A good case report will be clear about the importance of the observation being reported. A good case report will be clear about the importance of the observation being reported. Now, what are the advantages? These case reports can help in the identification of new trends or disease. What are the new trends? And means you have to identify first. This case report will identify the new trends. It will help to detect the new side effects or potential uses, whether it is beneficial or adverse. Newer uses of older drug or some new side effects, right? Educational way of sharing lesson learns, means whatever you have experienced you can report them to the others. So it's an educational tool. It will identify the rare manifestation of a disease. It will identify the rare manifestation of a disease. But everything has its own disadvantages. So cases may not be generalizable. It do not have external validity. It do not have external validity or generalizable to the group of population. It is unique, not based on the systematic studies. The etiopathogenetic mechanism is different. Etiopathogenesis is different. So it is not based on the systematic studies, and causes or associations may have other explanations apart from the given literature. Causes and associations may have other explanations and can be seen as an emphasizing the bizarre or focusing or misleading elements. Sometimes it will considered as or can be seen as emphasizing the bizarre or focusing on misleading elements. Sometimes it may happens. Everything has its own disadvantages. Okay. Now this is the case report which is given in the IJBCP. This is the case report which is explained in the IJBCP. It is not clear. Just wait for 1 minute. Yes, this is the case report which is explained in the International Journal of Basic and Clinical Pharmacology. It is just an example. Hemichoria hemibalismus as a rare presentation of non-ketotic hyperglycemia, a case report. Means in non-ketotic hyperglycemia, hemichoria and hemibalismus is a rare presentation, a rare clinical feature or rare sign, and which is reported by the various authors. All credit goes to them. So it is just an example which is taken from the IJBCP journal. So what I am trying to say, what is case report? It's a detailed presentation of a single case, which is something extraordinary or unique or rare manifestation of some diseases. So this is all about the case report.